Good morning, everybody, and welcome to Health Talk. I am your host, Dr. Niru Prasad, with my background in pediatrics, emergency medicine, and urgent care, affiliated with Henry Ford, St. Joe, Auckland, and Beaumont. The theme of our health talk today is how we maintain our body balance. Joining us today as my guest speaker is Dr. Dawn Thomas, and she's the masters of the physical therapy, and she has her own physical therapy units. She's going to highlight our viewers about what it is about, how you maintain your balance in the body. Good morning, Dawn, and welcome to my show.
Thank you so much. I'm so happy to be here, and I really appreciate having this talk with you today.
Sure. And then before we start, Dawn, can you give your introduction to our viewers?
Sure. So, my name is Dawn Thomas, and I am a doctor of physical therapy by trade. That is what I do. I own a company called Dawn Thomas Physical Therapy.
Okay.
And what we do is go into people's homes and do physical therapy with them.
Okay.
And I've been practicing as a physical therapist for 30 years, and during that time worked with people in all kinds of environments. And throughout my decades of work, I've really come to appreciate the importance of being proactive and preventative with our health.
Yeah. Okay.
And that's why one of the reasons I developed all of this work on teaching people how to improve their balance.
Yeah, that is such a good job you are doing. I need some
Yes.
myself. So, what do you want our listener to know about the balance? They may not know.
So one of the things I try to talk to people about that they're usually maybe not aware of is that how dangerous falls can be and how
Exactly.
important it is to try to
Yes.
prevent falls.
Yes.
And so I want to share with you some statistics, okay? So we know that if you think about 4 people that you care about that are over 65, one of them can be yourself.
Right.
One of those people are going to fall this year,
Sure.
okay?
Yeah.
And we also know that it's highly probable when you fall, when you're over 65, that you get injured,
Exactly.
okay?
Yes.
And then if we take that one step further and we think about one of the most common injuries when we fall over 65 is hip fracture.
Yes.
And if we take all the hip fractures that come from falls, 30% of those people will die within a year of that fracture.
Yes. You said it. Yeah.
Yeah. So that is sort of like a shocking thing to think about. But we also know that the people that survive and recover, half of those people don't achieve their prior level of function.
Yes.
So that means that falling, that just kind of drives home the importance of how dangerous falling can be.
Yeah. So, but from my background, from pediatrics, adult emergency medicine, senior citizen, lot of time, they come with a hip fracture, hip secondary to the fall. But before that, we are also thinking about the head injury, like forehead
Yes.
and head injury.
Yes.
So, tell me, how can a person tell if they have a balance problem? I know you mentioned already about the aging. Yeah.
Yeah. So, well, there's a couple things that I do when I'm first assessing someone for balance issues. One of the first things that I do is talk to them more about how they're functioning. And a lot of times the questions that I'm asking make them be more reflective about what they're doing in general terms that they might not notice. So it forces them to notice things that they might not notice. For example, some of the questions might be, do you avoid carrying things and walking at the same time? Do you avoid outings that require a long distance walking? Do you grab on to someone next to you when
Right,
you're in
yeah.
crowds? Like, these are things that make people think about how they're functioning a little bit deeper. And then if they're saying yes to a lot of these questions or even more than a couple, then I know that then balance is an issue for them.
Right.
Yeah.
And most important thing I have noticed from my practical experience working all these years is that when they walk in, watch the gate, how they are walking to you. If there is a stick, they have a chair, or whether white. So that
Absolutely.
doesn't-
Absolutely.
Yeah, you agree with me.
Yes,
Dawn, right?
absolutely.
Yeah, how they are.
Yes,
they are.
how they're walking.
Yeah.
Yes, absolutely.
So now we are talking about the biggest risk factor for having a fall. Anything else we can think of? Other risk
Well-
factor, head injury, injury to the general part of the body.
One of
hips,
the biggest risk factors for falling is a previous fall.
previous.
So-
oh, yeah, that
So
is
that's like a big red flag that there's something, but we want to catch it before that,
before
right?
that, right.
So there's a lot of things that go into maintaining balance. And this is another part that people don't tend to understand, that all of our systems contribute to maintaining balance. So our vision, our hearing,
Vision,
our muscles in our joints, our sensation, all of those things contribute to being able to be sturdy, right?
Right.
So if anything diminishes in those systems, so if my vision changes, if my hearing changes, if my sensation changes, if I have pain in a knee or a hip, all of those things are going to send messages to my brain that aren't going to give me the best information to maintain my balance. So all of those things can make my balance kind of slowly decline, and sometimes without noticing until something happens.
Yeah, so that leads me to the next question. Dan, what kind of exercises can help with the balance, since you are the expertise?
Yeah.
You
Yeah.
are the expertise in that.
Yeah, so the biggest thing I like people to understand to start with is that any movement is good movement.
Right,
Okay?
yeah.
So it doesn't have to be super elaborate exercise to get benefit out of it. So that's the first thing.
Yeah.
One of the first things I start with when I'm teaching balance classes is exercises that I call body awareness exercises.
Body awareness, okay.
So that can be something simple as sitting in your best upright posture and closing your eyes and becoming more aware of where your body weight is, if there's symmetry from side to side, if you have equal weight on both sides of your butt, things like that. I do in standing so that people start to get more feeling of what their feet are doing. And they'll start to learn a little bit more about where their body is in space. And so it's not something people picture as exercise, so to speak, but a lot of times that's where we'll start. So people have an idea of then when we start to move, what do you feel your body doing? What muscles are working?
Right. Yeah.
And then we become more aware of our feet, which are helping our balance a lot.
Right.
So that's kind of a very, like I like to talk about that because people sometimes are intimidated by starting a new exercise program.
That
right?
is true, yeah.
Yeah.
Oh, it's scared.
Yeah, yeah.
It's scared and nervous. What am I going to do?
Exactly. So sometimes it's nice to start with things that are beneficial, but not so intimidating. And then gradually get into things like strengthening and flexibility work that are super important to maintain your balance.
Right, yeah. So for our viewers to know, it is your own body, and before you realize what is the weak, you have to close your eyes, sit down, and check which area is weak for you, right?
Yes, yes. That's sometimes a very good starting point.
Yeah. So now, how does fear of falling play a role in balance?
So when we have a fear of falling, or and can you relate to that? Do you have a fear of falling a little
I
bit?
will. I have all the time when I walk down the stairs in my home.
Yeah.
I always hold the railing tight.
Yes.
Hold the railing tight.
Good. So when we develop a fear of movement or a fear of falling, it sends messages to our brain to constrain
right.
movement.
Yeah, yeah.
And so then what happens is we make our movements smaller because the brain is saying you're in danger, you're afraid of falling. So we make our movements smaller and less robust.
Right.
And then as we make our movements smaller, then we put ourselves at more risk for falling because, like you said, like when you observe the gait
I
and
know,
people make their steps smaller, you start to increase your risk of falling because your feet aren't clearing the ground as much.
Yeah.
So we get fear of falling. Our brain says, make the movement smaller, then it increases the risk of falling.
Yeah, I
So,
know.
yeah.
I tell you, it's not easy, everything to balance. And sometimes, it is the sandals you are wearing, the shoes,
Yes.
like go to the mall and then, if you don't look down on the ground, then
Yes.
you might slip over something.
Yes. And I noticed you have very sensible shoes on.
Oh my God.
I'm proud of you for wearing very sensible shoes.
Yeah, right.
Yes,
Yeah,
yes.
Yeah. So if you could tell us 3 things we could do today to decrease the risk of fall.
So the first thing I would tell you is to do something to assess your actual balance status. Okay. So
Yes.
something like this could be, there's a couple of physical tests that we do with people that tell us, oh, bless you.
Excuse me. Yeah.
Bless you.
It's the allergy. Yeah, go ahead.
So there's a lot of physical tests that we do with
Right,
people to
yeah.
assess their balance. But you can do some of these yourself. One of them is testing yourself in how you can get up and down out of a chair with no hands,
Okay.
and how long it takes you to do that 5 times.
All right.
Okay?
5 times.
Yes.
That is great.
So if you
Yeah.
can get, and so you have a goal of 11 seconds, okay? So if you can't get up and down out of a chair 5 times in 11 seconds or less, then your fall risk is up.
Okay.
Okay.
All right.
So
right.
that
This
becomes-
is one big risk.
Yes. So that becomes a physical marker for yourself to know that, and then also that becomes an exercise.
Right,
That
yeah.
can be a strengthening exercise, one of
Yeah.
the best,
Right,
getting up and
yeah.
down out
Up
of a
and
chair.
down,
Okay.
yeah.
So that's
Moving
the first
your-
thing.
Yeah, okay.
Yeah, that's the first thing. Do something to assess your own function.
Right,
Okay.
yeah.
The second thing would be do one thing to change your environment
Okay.
to decrease your risk.
Right. yeah.
Like,
Light is very important.
oh my gosh, that's great. That's a great example.
Yes,
So
light.
something as simple as putting a nightlight in the bathroom
Right.
can decrease your fall risk. Okay, so taking inventory of your environment and changing one thing to change your risk factor.
Right.
And then the third thing I would say is to find something fun to move your body. Okay.
Find some,
Yes.
the exercise,
Yes,
the
so-
aerobics, right?
Well, yes, absolutely. But it can also be simple things like that you don't think of as exercise, like gardening or walking with a friend,
right, gardening, right.
or anything that's going to require you to move your body. And that is going to help you improve your balance.
Yeah, so those are very good things, and I hear you have written a nice book
Yeah.
about this.
Yeah.
So tell us about this book that you have
So
written about.
we worked on this book. It's a workbook. So it's a Better
Okay.
Balance workbook.
Yeah.
And the point of this is to develop a tool for people to actually use. You assess yourself. You go by chapter. It's a
yeah.
6-week guide, and you're actually writing in the book, and you're
Right.
testing yourself.
So that is very good, because this is a very useful thing to have.
Yeah. Yeah.
Yeah, so we talked, did we miss anything? What are the 2 simple exercises we can do?
Well,
This is the last question.
the sit to stand, I think, so that's the
Sit
test.
and stand.
Yep, so getting up and down out of a chair with some repetition without your hands, that will strengthen your quad muscles and your butt muscles and your legs.
Okay.
And leg strength is super important for maintaining your balance.
Yeah.
Okay.
Right.
Then the second one I would say would be, if you're able, practice standing on one foot. Okay. So
But that's a little hard.
yeah.
though.
Okay. So good. So
I
if
tried to
if
stand on one foot and
Yeah.
then I fall.
so if that's too hard, then we do something called, well, we can stand just feet close together. Even that in itself can be a
Okay.
challenge.
Yeah, right.
Okay.
Yeah.
And then to make it, so this would be a little harder than standing feet side by side normal stance.
Put
Feet
it
together would make
Okay,
a
so
little
put
bit
the-
harder.
Put the two together.
Yep. And just practice balancing.
Okay.
And then to
stand up
Yeah.
on
Yeah.
your both feet and put those
Yep.
together.
Yep.
Yeah.
And then to make it a little bit harder, you can start to stand with your feet kind of lined up like this.
Okay.
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 So that would be how you would make it a little bit harder
Okay.
before doing the 1 foot.
All right.
Okay. So sit to stand
Sit to stand.
and practice balancing feet
Yeah.
side by side.
That is very
then
good
like
for
that.
our viewers. Sit and stand
Yes.
and then practice.
Practice standing, trying to narrow your base of support. Stand side by side,
Stand by.
then heel to toe.
Yeah, okay. So one more important thing, that we should talk about is the proper nutrition.
Oh yes,
Right.
That's a great subject
Yeah,
to
right,
include for
yeah.
sure.
A
Yeah.
proper nutrition, avoid
Yes.
the caffeine, and
Yes, and
especially for the senior citizens, it is very important,
yeah,
to avoid caffeine because it stimulates,
and just that well-rounded nutrition to get your vegetables and
Vegetables.
frequent meals throughout the day.
Yeah.
Because if people are skipping meals, then that can make your blood sugar go off, and then that can kind of
Right.
lead to some dizziness and
Yeah.
lightheadedness, which can predispose to falling.
So before somebody goes to your clinic, you must have a questionnaires and everything. You ask them, right?
Yeah, we do I'll have them do some intake, but usually when I'm working with people, it's very personable, and we're having a long kind of discussion and better understanding where they're coming from and what their goals are. Yeah.
So that's good. So basically, what age group you have included that you work with?
Well, a lot of my clientele is the older population,
okay.
and when we do these, we do balance classes and some exercise classes within the community that tend to draw the older community. So 65 and older would
65 and older.
Yeah.
Okay, so people can call you and then they can make an appointment.
Yeah.
And
yeah.
see you.
Yeah,
That is
and-
great.
Yeah, and there's lots of resources that I've written a lot about the balance
right,
stuff that you can
yeah.
read about and watch the videos and kind of get oriented to some of the
Yeah.
approaches that we use.
They have a lot of videos, and one thing we did not cover is about the meditation group. Some of the videos you must have it about the meditation.
Not specifically
No.
in the balance coursework.
Not in the balance course,
No,
okay.
no. But I do. I think it's a wonderful tool for sure.
Yeah, the
yeah.
meditation is
Yeah.
is so important, isn't
Yeah.
it? Yeah. But this is very good. So please give us the last minute keynote advice to our viewers who are watching this show.
Okay, so I think that the most important thing is to be very aware of your body and learn what your status is. Kind of be honest with yourself about how
Be
you're
honest,
functioning and
right.
what things that you need to work on. And take the step to get some professional feedback, whether it's with a physician or a physical therapist or someone in your community that you know has knowledge base on that, so that you can start something new and start to incorporate more movement into your routine.
So then one thing, I wanted to ask you, like people, those who have a past history of diabetes, high blood pressure, obesity, do you have a different regime for them? Or do they just go with your regular, what guidelines you have?
Yeah, so whenever we're working with people, we're always assessing.
Thyroid disorder?
Yeah, all of those things, like we talked about, affect your balance.
Affect the balance. That is
Yes,
true. Yeah.
especially the medications people are taking can affect the balance
Yeah.
and cause falls. So those are all things that we take into consideration when we're establishing a program that would be
Right, yeah.
appropriate for a person. And that's where the assessment comes in to learn, like, what I call it a training threshold.
Trainings.
Yeah, so because if something's too easy for someone, it's not going to get the benefit. And if something's too hard for someone, it's also not going to give them the benefit. So taking people's medical history into consideration.
Very important, isn't
yeah,
it?
yeah.
The past history, especially what medications they are on.
Absolutely.
Right? Because that can definitely, cheat you. So that's good. Anything else you would like to talk about?
I think we talked about a lot of different things. I think my message is always to really, movement is medicine.
Right.
And what you do today with your body is what's your insurance for later.
Right, yeah. Movement of the
Yes.
body. So the keynote advice is movement of the body. Keep moving your
Keep
body
moving.
in
Movement is
whichever way you can.
Yes,
right? Yeah.
absolutely. Absolutely.
Yeah. So then, I thank you a lot for coming to my show. I like to thank our viewers for watching me this show with Dr. Dawn Thomas, Better Balance Workup.
Yes, yes.
And if anybody needs to contact her, it is there on her website. And I'd like to thank our viewers for watching me on my show, my producer, camera people. And until I see you guys again, have a very safe and a wonderful summer.